Hello, everyone. I'm Dr. Nino Verzulli, Director of Country Health Programs at the WHO Regional Office for Europe. First, let me wish you all very best for the new year. May it be a healthy and a peaceful year that ends of the acute phase of pandemic and gets our lives back to normal. It is an honor for me to warmly welcome you all to the event to mark the World Cancer Day and the one-year anniversary of the United Action Against Cancer. Last year, WHO Europe launched the United Action Against Cancer, a pan-European cancer movement from grassroots to government with the vision to have a region where cancer is no longer a life-threatening disease. We launched it because of the urgency and the urgency to act now. Many of you know someone who has been touched by this disease, family member, friend, a colleague. And what is this fight is about? For me, it is also very personal, and I have committed to devote my professional life to do whatever it takes to ensure that no matter where one lives, gets access to preventive care, early diagnosis, and the effective and the quality treatment. No life should be taken out prematurely because the solutions that we know have impact in saving lives are not implemented or fully implemented. And together with finding innovative solutions to fight cancer, it should be a priority. Ending cancer causing suffer is possible, but it is possible only if all of us contribute and have a seat at the table. It is all about action and the action now to save and extend people's lives. It is my pleasure now to pass the floor to the Regional Director, Dr. Hans Kluge, who is spearheading the WHO Europe's movement, United Action Against Cancer. Dr. Kluge, floor is yours, please.
Thank you, Nino, and thank you all for joining us today. Cancer is one of the leading causes of mortality and morbidity in the WHO European region. It accounts for more than 20% of all deaths. In fact, 1 in 4 people will receive a cancer diagnosis in their lifetime, and 43% of the people receiving such a diagnosis will unfortunately die from cancer. But we can change this. 30 to 40% of cancers in Europe and Central Asia are preventable. In other words, we do have the knowledge and the tools to lighten the cancer burden. This is why the WHO Regional Office for Europe launched United Action Against Cancer, a movement to enhance collaboration across the region, from grassroots to government. The movement galvanizes everyone affected by cancer, young and old, parents and children, health workers, caregivers, civil society and policymakers. United Action Against Cancer is WHO's commitment to fast-track the elimination of cancer as a life-threatening disease through the implementation of cost-effective, evidence-based policies across the cancer care continuum. With this initiative, WHO is promoting signature solutions that include evidence-based screening to maximize benefits and minimize harm, and that tackle inequality and fight inadequate cancer policies that are often influenced by the commercial determinants and lack scientific evidence. Today, with the launch of our new guide on cancer screening, we have one more weapon in our arsenal. Every aspect of our work in the fight against cancer contributes to achieving the European Programme of Work 2020-2025, an ambitious yet realistic roadmap for stronger and more resilient health systems delivering universal health coverage, and where public health action and appropriate policies secure better health outcomes. This work also advances many of the health-related Sustainable Development Goals that we have less than 9 years to achieve. While COVID-19 has been a shock to the system, it has also shown us what we can accomplish when working together against a common threat. Every single one of us has felt the effect of cancer in one way or another. We all have a stake. This is why we need to join forces. WHO is stepping up to the challenge, scaling up efforts to assist countries in reducing the cancer burden and building a groundswell of support. We invite you to join us.
Thank you, Dr. Kluge. As Regional Director mentions, on the occasion of the World Cancer Day, we are publishing a new short guide to cancer screening area, which is one of the flagship initiatives of the United Action Against Cancer. We know that evidence-based cancer screening programs have great potential to improve the cancer outcomes, reduce the mortality, and prevent some cancers. Today, we will be having a panel of experts also talking about the screening programs. In fact, even before the pandemic, we had uneven progress in the region. Far too many screening eligible people, individuals, remained unscreened, and we already had disparities in cancer screening and survival among the most disadvantaged, experiencing social or economic barriers. And pandemic further aggravated these disparities, reduced the access to screening, causing delays in diagnosis and the treatment. We have unprecedented backlog in cancer screening, and certainly getting cancer screening back on track for those screening programs that known to be effective with proactive strategies and deliberate focus has to be the priority. We also see a worrying trend of non-evidence-based cancer screening in the WHO European region. The guide that we are launching today is easy to follow up document that summarizes the evidence and ethics around screening for cancer and addressing the key misconceptions related to screening, because knowing when not to screen for cancer is as important as knowing when not to screen for cancer. And it may seem counterintuitive, but the cancer screening is not always an appropriate strategy for tackling the cancer. Another key message in this guide that we are launching today is that screening can only deliver the best possible results when it is a part of a comprehensive cancer care, and importantly, the part of the pathway in the entire healthcare system, connecting people to timely diagnosis, to appropriate and quality treatment, and the follow-up. The guidance is very clear that it is unethical to promote screening when individuals being screened do not have access, or state cannot guarantee the coverage for diagnosis and access to effective and the quality treatment. And it is important to take into account the resources available, both human and the financial resources, when making the decision about introducing screening programs. We very much hope that you find this information and the guide useful in understanding of the role of the screening program in the cancer control program and the considerations that must go to ensure safe and effective cancer screening. Again, thank you all participants for joining us today, as well as the experts that will be speaking later in our panels. Now, let me introduce, it is my pleasure to welcome WHO Europe Cancer Ambassador Aron Anderson, who is an athlete and inspirational leader, helping WHO to create the grassroots movement to inspire action and draw attention to the importance of the prevention and early detection of cancer. Thank you, Aron, for joining us today, and floor is yours, please.
Thank you so much, Nino, and thank you for that introduction. My name is Aron Anderson, and I'm the WHO Europe's ambassador for cancer. And as you said in your presentation there, Nino, the importance of preventing cancer, I can't understate how important that is. I'm a cancer survivor myself. I had cancer when I was 7. I was diagnosed with sarcoma, bone cancer in my lower back, went through a year of chemotherapy and radiation, and eventually I had surgery, ended up in a wheelchair, and today I'm healthy. And not everyone is as lucky. I had a friend who went through a really similar cancer journey, but it took more than a year from first signs of the cancer until it actually was diagnosed, and I think that was a major reason why she didn't make it. So I'm incredibly passionate about making a stop to this. I'm so happy about this WHO initiative to do everything we can in our power to stop cancer. And I'm so happy to be here in the studio with you, Hans. And a year ago, this United Action Against Cancer was launched. What are your thoughts on this first year?
My biggest thought, I guess, Aron, is that we knew how important this initiative was, but I think we still underestimated it if we see what happened during the COVID-19 pandemic. As Nino was telling, it became very personal to all of us, because all of us have a colleague, a friend, someone in the family suffering from cancer. 30 to 40% can be prevented.
Yeah.
Also, a percentage cannot be prevented.
It's just such an insane number, 30 to 40%. I mean, do we know how many lives that could actually be? It's just so many.
Many. And at the same time, we need also to improve treatments, because some cancers cannot be prevented, right? And people have a healthy lifestyle. So we need a balance. We need good prevention, but also a good cure. And I really want to thank you, Aron. From the very beginning, you have been going with us, inspiring. Each time I'm with you, I feel very inspired as well, because you know what you talk about. And I really want to thank you for this, Aron. Thank you so much.
Well, thank you so much, Hans. And it's a pleasure to be able to lead this session today. And we have some questions for you, Hans. We have some questions from the youngsters out there who are very passionate about curing cancer as well. And the first question, we have a video coming from Krasimira Sayakova, and she's a youth ambassador from Bulgaria in the European Cancer League. So let's watch that video and see what she says.
All right.
My name is Krasimira Zaykova, and I'm a youth ambassador for the European Code Against Cancer for Bulgaria. As we all know, young people are key to amplifying and disseminating the European Code Against Cancer messages in particular, and also spreading awareness about European initiatives and European policies in their own countries. How can we foster cooperation among European youth, scientists, policymakers and stakeholders, and how can we foster youth empowerment and better listen to young people's voices? Thank you for your attention.
So Hans, this is a big question. How can the youth make a difference on this?
We absolutely need the youth with us for several reasons. First and foremost, the younger we start, the better. And we need to get better, we meaning WHO, in communicating messages to the younger people, whether it's about healthy environment, healthy lifestyle, but it's happening, Aron. My daughters will remind me sometimes about a healthy lifestyle. So
in what way? Can you give an example?
I think, for example, taking the bike instead of the car, right? I mean,
but you bike here to the office every morning.
Absolutely. I became half a Dane for that one, Aron. But healthy lifestyle, 20, 25 minutes a day of moderate exercise is the most cost-effective intervention, for example. But we need also the youth, because many of them, and this is something under stressed, are informal carers, are taking care of someone in the family who is ailing with cancer or other diseases. Also, they're future policymakers. In fact, one of the things we did is we established in WHO Europe here the first ever Young People and Young Professionals Forum, and for the first time we're going to come together in June in Tirana, the capital of Albania.
That's amazing. So if somebody listens to this and wants to be a part of that, what should they Google for? Like, how should they get into that?
They can contact WHO Europe.
Yeah.
Rob Butler is a focal point, but any one of us, Nino, the people, and will ensure participation and an active role. We're very committed.
That's amazing. So if you're seeing this and you want to be a part of this, send an email, like, do your thing, because we need people for this. We need everybody who has a passion for this to get involved and to make a difference. All right, so we have another question on video here. Next question is from Claudia Selinbat. She's a member of the Young Forum for Geistein. Let's watch her question.
Technologies are developing, and we know that innovative responses to cancer can save lives. However, technologies can sometimes do more harm than good. What process is in place to ensure that policy decisions, and notably decisions made under the EBTP on the use of these technologies, are guided by solid evidence? And what has been the contribution of the European Parliament, and in particular the health communities, to address this challenge?
That's an excellent question. And we actually have a video answer to this question as well from Sarah Cerdas, who's a member of the European Parliament. So let's watch her answer and then we can talk about it.
Hello everyone, and thank you for having me here. Thank you, Claudia, for your question. Here in the European Parliament, we have been working in the Europe's Beating Cancer Plan. I have had the honor of vice-chairing the Special Committee on Beating Cancer. This plan has 4 important pillars that aim at prevention, at early diagnosis, at accessibility to treatment, and also quality of care for patients, families, and carers. On the prevention part, we have that 30 to 50% of deaths by cancer could have been avoidable. And we aim to bet and increase the health literacy of the population in order for our citizens to make healthier choices for their lifestyles. How are we bringing more evidence to all this process? We are going to have a European health data space that hopefully will be launched soon by the Commission, and then it will be worked here and at the European Parliament. Here we will have better data in order to give us more information so we can legislate and address the health needs of our population. We must not forget that data protection is an important part of all of this process, and this will increase research and innovation in cancer for all the different steps, and also will create more scientific evidence, not only for legislation but for action. Also, for us to keep working in legislating with the best available evidence, we work hand in hand with different institutions. We work hand in hand with the World Health Organizations, with different institutions such as academia, in science, so we have the best knowledge available and then we can legislate accordingly. This is at the core of what we aim to do here in the European Parliament when we are shaping the health policies and working towards a European Health Union. Once again, thank you very much for having me here, and I wish you a great event.
So that's a great answer from Sarah Cedras, but can you see that from the WHO side that there are treatments that are being used that are not evidence-based?
It's a biggie, Aron. I mean, we call it the commercial determinants of health. So that there is and we have to be very frank in this, that there are entities who are trying to influence unhealthy policies and providing wrong evidence to weaken tobacco control policies, alcohol control policies. So that's why providing the right evidence, translating it in a language that people understand is very important. Ultimate, our vision is to create a culture of health in Europe, where every individual, independent of ethnicity, gender, is enabled to make healthy lifestyle decisions.
And everybody should have access to like the right information as well.
Yes, excellent. Yes.
I mean, we've been seeing that with COVID now. There's so much information. It's really hard to determine like what is actually evidence-based and what is not.
Yes, it's a tough one. Yeah. And there we also learned lessons in the WHO that we need to link up with people like you, Aron, with influencers that can transmit easily and credibly a scientific message to the community.
So is that lessons you've learned from COVID fighting that you can bring into cancer?
Absolutely. I think what we need is influencers.
Yeah.
People who credibly speak, who as yourself know what you talk about, and it's the collaboration which is very powerful, including with the youth, the European Parliament, also the Inter-Parliamentary Assembly for the former Soviet Union countries. So we need a very strong partnership there.
Yeah. Hans, that's amazing to hear. Thank you so much for joining us at this session. I love your passion for all of this. You have so many things you're working on at the WHO, but I love your passion for the cancer questions. And thank you for this. And we're going to hand back the word to Nino, and she's going to introduce somebody who's very special to her.
Thank you, Aron. We may think that when the patient gets cancer diagnosis and start the treatment, the health providers have done their job, but it's not helping patients to navigate through the complicated system of cancer care, because cancer is the many different diseases, and understanding treatment options and helping patient to make the decisions about treatment, no matter how well they might be informed, is of course an important aspect of the cancer care. But dealing with patient fear and anxiety, searching and understanding patient's potential and stimulating it, and of course, influencing the patient attitudes towards the cancer is another important and a very big part of the cancer care. And this can only be done through putting patient at the center of care and guiding the cancer patient across the cancer trajectory. The short film we are going to present now highlights the uniqueness and the significance of nursing and the nursing profession in the journey of the cancer patients, and fundamental needs of patients throughout this cancer journey nurses can address through personalized care. And I'd like to present one of such nurses, Tina Doe, who works at oncology clinic at Rick's Hospital, to share with us these fundamental needs of patients that she addresses in every day in her work. Please, if you could put the video on.
Det er jo sådan, at når patienterne kommer og hører ordet kræft og kemoterapi, så stritter hele nervesystemet på dem. Jeg skal hjælpe dem igennem noget, som er fuldstændig uudholdeligt. Jeg tror, det, der er vigtigst for os, det er at forstå egentlig i starten på ganske kort tid, hvad er det for en person, der sidder foran os? Hvad er det, der er vigtigt for dem? Hvilke bekymringer har de i forhold til det, de skal igennem? Og det gør jo også, at vi også skal have noget lethed ind i mødet, fordi det kan ikke være sorgfuldt alt sammen. Vi skal jo ligesom have bygget dem op, sådan så de også kan klare behandlingerne. Altså der, hvor jeg synes, det er en god dag, det er der, hvor man pludselig mærker, at patienterne selv løfter ind i opgaven. Det vil sige, at vi har hjulpet dem til at forstå, at hvor skal de have fokus. Motivationen for patienterne er vigtig, og det er den, fordi at hvis de bliver motiveret til at tænke, at de kan løse opgaven, så er de faktisk i stand til at mobilisere deres egen energier ind i det. I dagligdagen og i behandlingsforløbet, så prioriterer vi faktisk at have tiden til at finde ud af, hvad det er for nogle ressourcer, de har på et givet tidspunkt, sådan så de bliver i stand til også at gennemføre deres behandling. At man spørger, jamen er du træt? Er du trist? Har du problemer derhjemme? Så man accepterer ikke bare, jamen jeg har det godt, det er gået fint siden sidst. Altså det går ligesom lidt dybere ned, når man også møder patienterne, ikke? I forhold til patienterne, så arbejder vi jo med noget, der er virkelig alvorligt, men samtidig så skal man jo også leve og have sin hverdag og sit liv. Så det er jo en balance mellem et behandlingssystem og så patienternes hverdag. Og det er en balance, som vi er heldige at opnå i rigtig mange tilfælde.
That is a truly beautiful video, and there are so many incredibly important healthcare workers out there. I mean, I've had cancer myself. I've been to the hospital more days than I want to count, and I have so fond memories of so many incredible nurses and doctors and other people working at the hospital. So I just want to say thank you to all of you if you're a healthcare worker listening to this. But now we're going to move on to the next stage here in our live show. And that next stage is to bring on the experts. So here we have the incredible experts that we have at our disposal here. They are from different organizations, and we're going to do a bit of an introduction of them. First, here on the left, we have Wendy Jarrett, Director of Association of European Cancer Leagues. Say hi to the audience, Wendy. Hey. And then we have Tit Albrecht, who's the coordinator of Joint Action Innovative Partnership for Action Against Cancer. Yay, wave, nice. And then we have Andreas Charalambos, President of European Cancer Organization. Great. And we have Dilshud Gambidiev, the Cancer Control Specialist of the National Cancer Center in Uzbekistan. And last but not least, we have Siniša Varga, the former Minister of Health from Croatia. So welcome to all of you. We're so happy to have you here with us, our experts. So we're going to talk about some few different topics today. And this discussion is going to be about half an hour. And if you have, you want to add to any of what the other speakers are saying, just try to raise your hand and we move the word towards you. So I actually want to start with you, Siniša. You are a former Minister of Health in Croatia, and right after you stepped down from that position, you got cancer yourself. Can you tell me a little bit about that story, and is there anything you would change with that knowledge that you got from having cancer yourself?
Well, I was also director of the Croatian Health Insurance Fund, and then after that, the Minister of Health, which meant that I had absolutely no time for taking care of my own health. When I became member of parliament, I said, well, maybe it's time to go see a doctor and make an annual checkup. And at annual checkup, during a coloscopy, they found colorectal cancer. They got operated right away. The operation was successful, and here I am 5.5 years later, skiing, swimming, motorcycle riding, and enjoying life.
That's amazing. I'm so happy for that.
Yeah, I'm not letting cancer define me, but in the back of my mind, that I'm doing my regular checkups all the time.
So screening is incredibly important to prevent cancer. We all know that. And now with that learning in hindsight, would you have done anything different when you were a minister?
Yeah, well, in Croatia, you're obliged to have your annual checkup of your automobile. It's very, very necessary to see your doctor at least once a year, do an annual checkup and make sure that cancer is very early on, because as Hans said, the chances of you getting cancer during your lifetime is very, very high. And it has to be caught early. Only early caught cancer can be cured. Anything that goes too far, when you start to have bleeding, when you start to have pain, that means it's gone too far and your chances of survival are very slow and very slim. National cancer screening programs are very important. So if in the mail, or if you get an invitation to come for a mammography or cervical cancer screening or anything, be sure to listen and go get this checked, because as I said, only early caught cancer can be cured.
Definitely, that's some really good points you have there. So can I ask you about this, Tit? The benefits of screening we know are good, but what kind of screening should we do, and at what point should you be screened? Like, if you're just a normal citizen watching this, like, what should you think about for screening if you don't get that mail in your mailbox?
Well, first of all, you should be aware that there are cancers occurring at different points in life. As your experience says, Aron, this is very important to keep in mind. So cancer is not limited only to elderly people or to people of one gender, or only those exposed to certain risk factors. It is important to join the screening programs. As Sinisha indicated, sometimes we feel that it's just not the right moment, that we don't have time, but actually we do have time. All the screening programs that have been adopted and recognized are very, very simple procedures and don't require an investment of time, and they are extremely important. Obviously, we have to think about the disease, and it's very difficult to imagine when you're healthy, as you said, Aron, feeling well, feeling in shape, in great spirits.
Yeah, it's like Sinisha said, like you're working, you're living your life, you're too busy to go screening.
And I can tell you one thing, that during the COVID pandemic in my country, in Slovenia, we did the best effort to bring all the people still into the screening programs. And we succeeded with all the efforts of the entire community participating in the organization of these programs.
So can I stop you there and ask, what did you do that many countries didn't do? Because I know a lot of countries had less screening or still have during the pandemic. What did you guys manage to do that made this screening go on?
Well, we first of all, we had to reassure in some cases the health professionals, in the case of colonoscopists, for example, that they would not get overly exposed. And the population, of course, the way that we invited for screening, especially colorectal cancer, which has been mentioned already today by Sinisha, which is mostly carried out by mail, was not exposing people to any serious disease. And we have never canceled screening programs, only during the first wave for a short period of time. And then we managed to catch up. It was very important also to keep the confidence of the population. Every one of us feels safer if they can be confident that the procedure they are entering or trying or need to join is really carried out the way it is supposed to.
I think Andreas wants to add something there, raising his hand.
Thank you, Aron. Just to elaborate on what Tit is saying at the moment and mention here the Time to Act campaign that it has been launched by the European Cancer Organization. It's a pan-European campaign trying to raise awareness about cancer screening in the time of COVID. And because we do have numbers and not data, abstract data, for example, it is estimated that only in Europe there are about 100 million diagnostic tests that have not been performed as a result of the COVID pandemic. And this number translates to 1 million of Europeans not being diagnosed.
Yeah, that's what I was going to ask you. So do we know actually how many deaths that would probably translate to?
Well, if we translate that to 1 million people not being diagnosed, then I think that the statistics are there.
Oh, yeah.
It's a huge number.
Yeah, exactly. So that's amazing that in Slovenia you've been able to keep going with the screening, and I hope we can do that in many other countries as well. At least get it started again. But Dilshad, I know you guys been working with this in Uzbekistan with getting screening programs up. Can you tell me a little bit about your experience there?
So we have started the pilot screening, mammography screening in one of our region, and already we have many early stage breast cancers. As well, we have started pilot HPV DNA test for the screening of the cervical cancer. So in the two regions, as well, we have developed jointly with WHO and the IR the early diagnostics programs for the GI cancer, particularly for gastric cancer and colorectal cancer. And we are planning for HCC, hepatocellular cancer, also planning the early diagnostics program, which we are planning to do in the national level.
That's great to hear. And have you been able to do this now during the pandemic? Or how's that been affected?
Yes, but not fully. As I said, the breast screening and cervical cancer are the pilot projects, which are now ongoing. During the pandemic, there was interruptions as well, but we are trying to do it by our calendar on time.
That's great. And has it been successful? So you're going to move this pilot project onto the rest of the country?
Yes. We are planning to spread out it on national level.
Yeah, that's great to hear. So when we're talking about cancer, one of the things that we need to address as well is how can we prevent cancer, right? And Wendy, do you have any input on that? Like, what can you actually do as a person to prevent your risk of getting cancer?
Hello, Aaron.
Hello.
Thanks for having me here. And I just want
great
to
to have
also,
you.
and I want to echo, it's amazing to have you as an ambassador because we need, especially the young people, they need a model figure to look up to. And I think it's amazing the job that you're doing. So preventing cancer, absolutely. Dosha just mentioned IR, which is the International Agency for Research on Cancer. Believe it or not, there is a set of messages that was created by the IR, International Agency for Research on Cancer, which is the cancer research arm of WHO. This is called the European Code Against Cancer, which was established some 40 years ago now. And these are messages that a regular citizen, person on the street can take and actions they can take to prevent cancer. Even though it's almost 40 years old, it's amazing how little knowledge there is around this code. And, these are actions that people can take. So there is a set of messages. If you go to cancercode.eu, it's there. Simple things such as, it was already mentioned, healthy lifestyle.
So can I stop you there? What is a healthy lifestyle?
Yes, so it includes several ways of leading a healthy lifestyle. The most obvious one, and where we have lots of evidence, tobacco control. We all know that we should not smoke. We all know that we should not be, intake any kind of tobacco product. So if you just by not
because
smoking,
there are coming lots of new tobacco products, without actually smoking, like this electronic stuff. And is that causing cancer as well, or is it safer? Like, how should young people think about this, or everybody?
So the evidence is still, collecting out there, and I don't want to go into this area because it is rather controversial. That no tobacco products. First, no tobacco products. Limiting or even just cutting out alcohol, big thing.
So how bad is alcohol? I mean, a lot of people have a few drinks a week or something. Can you have that, or can't you have anything, or what's the limit?
So the evidence shows that not consuming any kind of alcohol is better for you for cancer prevention. Yeah. And what people don't realize is that alcohol is linked to at least 7 types of cancer. Can you imagine that, Aaron?
Oh, wow.
I mean, people just don't realize that. I mean, I think the most common ones people realize, like breast cancer, throat and mouth, but it's also linked to esophageal cancer, throat, liver, colon. There's a whole bunch of cancers out there. So better to not drink any alcohol at all. And then, maintaining a healthy diet, right? Healthy weight. That's also part of the healthy lifestyle. We talking a lot about screening, but that's also part of the lifestyle, making sure that you respond and you participate in screening programs is very, very important. Another area that is very overlooked in preventing cancer is UV, exposure to the UV. So by being out in the sun, I know that, Aron, you're in the Nordic countries, you're in Sweden and Denmark.
We don't have any sun, so it's not a problem for us.
Well, believe it or not, you go out just by being out, even though you don't really see the sun, there are UV rays coming through. So, obviously it's not going to be a big problem for you as more, it's more in the south, like where Andreas is in Cyprus. But the problem, believe it or not, in the Nordic countries are the UV cabins, the sunbeds. You guys have a lot of those in the Nordic countries because people feel, okay, I don't get enough sun. I'm not in the outside, so I'm going to use a tanning bed, which is extremely, extremely dangerous. And, there are no regulations around that. And young people, they use it a lot. So
do you know what the data actually says on how dangerous sunbeds are?
I'm sorry, say that again.
Do we have any actual data of how dangerous it is to use a sunbed?
Oh, absolutely.
Tanning bed.
There are lots of evidence out there, especially among, the under 18. The evidence that we have, we're looking at the regulations. We're talking about, earlier you were talking about information with Dr. Kluge. We need to have evidence-based information out there. There's a lot of evidence-based information out there regarding UV exposure. And we know that when you can regulate sunbeds, not the coin-operated ones, for example, that are so rampant in the Nordic countries, it's very much linked to skin cancer and melanoma, which is the most dangerous kind of skin cancer. So when it's under 18 use, especially, if you so what happens when you're out in the sun? Your skin changes color. What does that mean? It doesn't mean that, oh, you look beautiful now because you have a tan. What that means is that there's damage to your skin. This is why your skin changes color. And people don't realize that you're damaging your skin. That's why the color has changed. And, a tan should not be considered beautiful. A tan is actually evidence that you're just damaging your skin by being out in the sun. We know that among the young people.
What about vitamin D? Isn't that really important to get some sun on your skin so you can get the vitamin D?
Yes, but you can get vitamin D by so many sources. You can eat salmon. There are many other ways of getting vitamin D. You don't need to expose yourself and increase your risk of getting skin cancer just to make up for that vitamin D. And, it's people like you and, earlier you had one of our youth ambassadors from the European Association of European Cancer Leagues. And, we count on you guys to be our ambassadors out there to let the young people know, it's not good to use tanning booths. It's not good to be out in the sun for too long without protection. Better to lead a healthy lifestyle. There's so many ways. Dr. Kluge already mentioned that, up to 40%, even 50% of cancers can be prevented just by individual actions. I want to also, if I can just also mention that individual actions are very important, but governmental policies need to be able to support the individual actions. And this is where it's very important that we need to get the government, not only at the national level, but also at the European level involved to help the individuals take action against the risk of getting cancer.
So Sinisa, you've been at that level. What have you seen actually has been a good way to make people live a healthier lifestyle, to drink less, to tan less, to do all the things that causes problems? Because if you say this to somebody young, no, you can't drink, you can't smoke, you can't tan, you can't do you take away a lot of what they might perceive as a good quality of life to have a good quality of life, maybe 20, 30 years later. But for you as, somebody who worked in the government, what have you actually seen being effective to do as a government person in this? I think you have to unmute yourself because we can't hear you. Sorry.
So I always look at this as there's two sides of the coin. So on one side, we have the population, we have the individuals, families, communities, and everything that they can do to reduce the chance of getting cancer. This is something that is very, very under the big umbrella called the media. So media, not only newspapers, but I'm talking about television shows, movies, generally the culture that is raised about having a healthy lifestyle. What I've noticed very lately is that a lot more famous people, influencers are being shown with cigarettes, alcohol, etc. That was a taboo for a very, very long time. Now it's coming back into fashion. How is this resulting? It's resulting that in the young population, we have young girls smoking more than young boys. So this is something that media and influencers and everything has a very, very big impact on how people act. On the other side, we have schools, everybody involved in the upbringing process, and the leniency coming around from parents lately that are preoccupied with their own problems and lifestyles. And children are very, very more susceptible now to media and influencers. And it's a big responsibility that the healthy lifestyle is pushed in the forefront. And things like smoking, alcohol, bad food habits, lack of movement, video gaming, for instance, and binging on video games for 24 hours, not even seeing any daylight or fresh air, is something that is very, very much changing. And for instance, childhood obesity, like young people having being way too overweight, is something that is overtaking Europe. And this is something in the long run, in the 20, 30, 40 years, the statistics of cancer, diabetes, high blood pressure, this is going to be going out of the over the roof. And this is something that we have to act on now to prevent long-lasting detrimental things in the future. On the other side of the coin,
from a policy level there, from like a policy level, what has actually been effective? Like, can you put like a higher tax on cigarettes, higher tax on sugar, higher tax on alcohol, or like?
So WHO has the evidence showing what has that influence is access and cost. So for instance, tobacco and alcohol products, if you reduce the access for young people, enforcing the age of 18 not being able to buy tobacco and alcohol products on one side, drinking age in the United States is 21. Maybe this is something that Europe should start looking at, to move it to 21, when people start to think more about their own health. And also, on the other hand, that's the access and the price size. You have excise taxes and making sure that it's way too expensive for young people to buy it. So this is something that is showed, like, for instance, Australia is one of the forerunners in reducing harm from tobacco and alcohol products. And this is something that very many countries should look into, including in their policies. And I think the WHO can help very, very much individual countries through their country representatives to enforce these type of policies.
So now I have like an open question to all of you. Should you be able to kind of decide for yourself, like, I want to be unhealthy, I want to do all these bad behaviors, or like, because we have like the personal freedom, and at the same time we have what we want to do as like on a higher level, because we want everybody to be healthier. Maybe Tit, you raised your hand. Do you have an answer to this?
Yes, I think Hans, when you asked him about a more generic question about prevention of cancer, and he mentioned starting at a young age, and I will pick up on what Sinisha has underlined. It's there where we form our habits. It's there where we can make healthy choices. It's much more difficult to change lifestyles in the middle of the life course when they have been adopted. For example, one of the reasons why we should delay the start of the use of tobacco is that studies have shown that people who do not start smoking until the age of 22 are very rare first smokers later. So initiation of healthy lifestyles is essential for the first step. The second thing, I think, is general awareness that cancer is going to affect 1 man in 2 and 1 woman in 3 in Europe in the next decades. Yeah. So it's not a disease of some specific risk groups. And the third thing is that we should require our health systems to provide comprehensive approaches to cancer, from prevention and screening to good quality care and all the supportive care that cancer survivors and cancer sufferers require.
Yeah.
Thank you.
I totally agree. Thank you so much for that answer. And I want to move on to kind of our last topic of the day, and it's the inequalities in care. I mean, Europe is really big. We have some extremely rich regions, we have a lot of poorer regions, and how can we tackle those inequalities? Maybe Andreas has some answer to this.
Thank you, Aron. Thank you for having me in this panel discussion. It's a pleasure to be here with these experts from around the world. Definitely inequalities and inequities are a very major problem, not only in Europe, but also it is a global problem, because those systematic differences that we see in the health status of different population groups, they stem basically from actions deriving from the government, stakeholders, and communities, and the way to tackle this is through public policy. And we have seen the WHO and now the EU Beating Cancer Plan has acknowledged this high level of inequalities across Europe, and through the EU Beating Cancer Plan we will be having the initiation of the cancer inequalities registries, because in order to be able to tackle a problem, first of all, you have to be able to measure it. Nowadays, in terms of inequalities, there is very scarce research, not systematic evidence demonstrating how big the problem is or how severe it is, or in what ways it affecting the person, communities, and the countries as a whole. So we need a very powerful tool, which is called data. Data used in a very effective and efficient way. And I think the cancer inequalities registries is one way to go about. I did mention earlier the campaign about COVID. And we, as the European Cancer Organization, we also launched the Data Navigator, which shows and demonstrates a live image of how countries are tackling COVID in real time. Such kind of evidence is essential in combating inequalities, and we need to find better ways, I think, in incorporating those data into decision-making processes on a policy level. So in terms of also combating inequalities, we shouldn't be forgetting the health literacy and digital literacy. For example, we have mentioned and we have championed and we have seen technology as the panacea of treating many problems within the health sector. However, there is digital literacy in that sense as well. We cannot take for granted that all people are equipped to deal with technology in the same way. So we don't want to create new technologies or new interventions that in turn, they create more inequalities for either marginalized groups or the society as a whole. And of course, we have excellent examples. For example, International Agency for Research on Cancer, through who we can use the European Code Against Cancer, for example, which is an excellent template which we can upscale and influence governments and a person in order to, as Wendy and Sinisha said, to follow a healthier lifestyle and living despite where they are living, because health inequalities come to this question. It shouldn't be matter where you're born, whether you are young or older, whether you are male or female, and so on. It shouldn't be matter to the level of healthcare that you will receive in relation to cancer care and treatment.
I couldn't agree more with you, Andreas. Thank you so much for that answer. And I want to say thank you to all our participants here. Thank you so much for joining this discussion. Unfortunately, our half hour is up. We're not going to be able to continue this, but thank you for all your brilliant ideas and all your passion to solve this big problem we have with cancer. So I want to thank you all, and thank you also all to our viewers who's been part of this live broadcast today. There are going to be more broadcasts like this, so stay tuned for more. And we're signing out from the UN building in Copenhagen and from the WHO headquarters here in Europe. Thank you so much, and stay tuned for more.